I'm meeting patients anywhere from somebody who was diagnosed 10 days ago to someone who's had a tumor for 10 years. So you can imagine that those families have had different experiences talking to their kids, because if it's brand new, that's the family who's like, oh my gosh, what do we say to our kids? If it's 5 years ago, they've either done a pretty good job or not. Maybe, I've had a few families who literally told their children, I bumped my head on the airplane wing and, I'm fine, there's no problem, nothing's going on. And then they have to backtrack because kids start to figure things out. So on day one, it's all the medical visit, and then on day two, the nurse does the teaching for their treatment plan. If it's been determined, they automatically meet our social worker. They automatically meet me, and I find out if there's a need. And I also oversee our learning center, which is sort of a hands-on resource room. And then if needed, they can see our neuropsychologist, one of our clinical trials folks, sort of after the nurse, the social worker, and myself, and a clinical trials person are sort of the automatic people. And then beyond that, we can pull in others if we hear that there's a need. So starting with diagnosis, and I don't know, let's see, how many folks are dealing with a diagnosis that's less than 6 months old? Anybody? Less than 6 months old? 6 months to a year old? Okay. And then 2 to 3 years? Or longer? Okay. Okay. So you all have had to talk to your kids. When I talk to folks, one thing, of course, you have to think about is how old your child is, and not only how old they are, but what's their developmental level, because not all 7-year-olds are exactly the same. You need to think about their personalities. Do you have a child who's a worrier? And needs information bit by bit, carefully, little by little? Do you have a child who is way into science and thinks all those staples in your head are cool? And can they please take a picture of it for show and tell? Because I have kids like that. Do you have the child who sort of gets it right away that what's going on isn't good, and when they find out what's going on, they get very upset and they're sad and they cry, and you maybe instinctively feel like, oh my gosh, I never should have said that. But the reality is that's a very healthy, normal response, even for any age, adult, teenager, child, to finding out that somebody you love has a serious illness. So what I try to help families do is to meet kids where they are and not to worry. Certainly there are some responses that you might be concerned about, but there's a wide range of responses that I would call perfectly normal. And that can range from you try to tell them what's going on and they interrupt you and say, can I have a cookie? To lots of science questions about why did the doctor do this and what are they going to do about that or whatever, to the child who just is more emotional and gets upset. So trying to meet them where they are and to support them and move forward from there is important. What have your kids seen about illness or life-threatening illness or death in nature, in movies, in real life, heard from their friends? Those are things to think about. Did they have a classmate whose parent had cancer and survived and is doing great? So they think cancer is something that you take medicine for and you get better and everything's fine? Or did they have a classmate whose parent had cancer and didn't survive, died, and so they think everybody who has cancer dies, and that's not true either. So trying to figure out where your child is coming from when you have these conversations is important. And I always tell people that I work with, I have 25 years worth of experience working with families who are experiencing illness. You all are the experts on your children. You know their personalities, you know how they take in information, and so there's no other way to do it but to work as a team, because I don't know your kids. I can make suggestions. You have to listen to my suggestions and say, yes, that would work for one of my kids, but not for the other one. That would be bad for him. So you really have to weigh anything you read in a book or hear in a lecture or read in a brochure and decide what's appropriate for my child. So nothing is absolute. It's really very fluid. What are your spiritual beliefs? What are your religious beliefs? And how do those play into your understanding about cause of illness, outcomes of illness? And what have you shared with your children about that? I work with families who are what they would describe themselves as realists. And they tell their kids, boom, I have this tumor and these are the statistics and this is what's going to probably happen to me. And then I have, of course, a whole range of folks who are much more hopeful, which you should be, because there's so much out there to be hopeful about. And then folks who say, I'm going to be the one to beat this, and I can do this. And so thinking about what messages you're giving your children, and I'm not going to tell you that any of them are wrong or right. It's just important to think about how your family's operating, because that plays into how your child copes. So none of them are wrong or right, but being aware and insightful into what your religious or spiritual or life-meaning beliefs are sort of plays into how you cope with any difficult situation in your life. The other thing that comes up a lot is, this is huge for you, this diagnosis, but many of you have had to deal with other difficult circumstances. And so also thinking about, how have we dealt with other hard things in our lives? Maybe not as hard as this. Did we do it the way and come out in a way that felt healthy and good? And did my kids come through that difficult situation feeling competent and like they mastered it? Or did they come out of that situation feeling overwhelmed? You know, it might be the death of a pet, it could be a divorce, it could be moving to a new home, it could be changing schools. I mean, a lot of things in life are hard at different levels, but you have to use the same coping skills to different degrees to deal with all of those changes. So thinking back over what other adversity has our family encountered, how did we deal with it, and do I feel good about how we dealt with it, or gee, do I want to do something different this time so that I feel like we come through this in a better way? Another thing to think about, and this comes up a lot, is when you were children, how did your parents talk to you about illness or death or difficult situations? Because a lot of that trickles down, and it can trickle down in a couple different ways. It can be, oh my gosh, I hated how my parents did it, I'm never going to do my kids that way. Or it can be, that really worked for me, you know, that's how I'm going to talk to my kids. But that's another thing to think about, is your childhood and how you experienced adversity or family illness, and what are you bringing from that to your situation. What is your relationship with the person who has the brain tumor? You know, if you're very, very close to that person, that's going to impact your ability to communicate with your children differently than if you're not that close to that person. You know, if it's a distant cousin, you can probably talk to your kids pretty easily. If it's your spouse, it's a lot harder. So just thinking about that relationship and how that plays into how you talk to your kids. As adults, I think we all have some sense of wanting to protect our kids from difficult situations, especially diagnoses of brain tumors or cancer. But what we don't often realize is two things. One is, kids frequently have that same built-in mechanism. I'm not going to ask that question because somebody might cry. I might make a grown-up cry. I don't want to make a grown-up cry. That's too scary for me. I don't want to upset anybody, so I'm just going to be quiet and keep this to myself. So that protective mechanism goes both ways. The other thing that comes into play is, once we open ourselves up to our children and tell our children, I have a brain tumor, it's a serious kind of cancer, but there are treatments for it, and these are the treatments that I'm going to take, and this is our goal, and this is our hope, you are vulnerable to being open to those children's questions all the time. Now, as adults, we want to deal with this brain tumor when we feel like it, and we want to deny it and listen to good music when we don't feel like it, because we need a break emotionally. When you tell your children what's going on, you're at their mercy. Your 3-year-old, your 7-year-old, your 10-year-old, at any moment can come to you with a question that you're just not in the mood to deal with. And so some of that protection is self-protection, because you're like, ooh, you know, I'm just not in that space right now, so I can't tell them, because if I tell them, they might then want to talk about it, and I'm not in a space where I can do that. And again, I'm not saying that's a terrible thing, but it's the insight that's helpful. Knowing what it is that's keeping you, knowing what your barriers are, help you break through your barriers so you can get to a point where eventually you can tell the kids what they need to hear.